Hey guys, welcome back to the show and welcome to the last day of January. Can you even believe it? I can't believe the first month of 2025 is behind us already. It's nuts. Anyway, we have so many exciting things going on coming up, and I wanted to share a few of you with them before we even launch into the episode. So number one is that if you are a nurse or you know a registered nurse who listens to this podcast, I have amazing news for you guys. This podcast is part of a program called Renegade.pro. And Renegade.pro is a program that allows you as a nurse to earn CEs, continuing education credits, just by listening to the podcasts like this one and other amazing podcasts. So to learn more, all you have to do is use the link in the show notes and it will take you to Renegade Pro. It'll show you how you can register and how you can earn continuing education credits just by listening to podcasts that you love. So that's if you're a nurse. To everybody else, if we've never met, and if you are going to be anywhere near Florida, particularly Miami, at the end of this month, I'm going to be speaking at Biohacker Expo on February 28th at 11 a.m. on the main stage. If you're interested in coming out to listen to my talk and other amazing talks, I mean, she's got an unbelievable lineup of speakers. She being Sandy Martin, who's putting on this event. She's got guys like Dr. Kent Holtorf, Ben Azadi, just like an unbelievable lineup of speakers. If you're interested in coming in live, check it out, Biohacker Expo, and you can use code NAT50, which will save you a whopping 50% off of your ticket. All right. Number 3, the last announcement that I have for you is that we are relaunching the membership community. We are taking, actually I have 2 more announcements. We are taking, basically you can join as of Feb 1. We've kind of closed up the membership for a couple of weeks because we were doing some upgrades, some renos, reorganization, the whole 9 yards. So starting Feb 1, we're going to be taking new members again. And so you can get details about that at natnidham.com as always. And then last but not least, there's the retreat that I did a solo episode about back at the end of last year. I think it was in November. And that retreat is happening in Sedona on March. I had said in the podcast it would be at the beginning of May. We actually had to change the dates. So it's happening from March 24th to March 28th. So end of March in Sedona. It's an amazing retreat. Check out the episode. We'll link to the episode down in the show notes. If this feels like something that you would enjoy and would want to take part of, then definitely give us a shout and let us know, and we will get you some information. All right. Beyond that, of course, I want to thank you for listening to the show, and we have blown past 2.5 million downloads. We're coming up fast on 3 million downloads. So amazing. Thank you to all of you for listening to the episode, for your comments, your questions, your feedback, all the things. My guest today is Dr. Michael Ruscio. He is here to unpack why your digestive system might just be the key to feeling amazing or awful. We'll talk about the new classification of IBS as a gut-brain interaction disorder and how small intestinal bacterial overgrowth, SIBO, might just be behind your discomfort. He'll bust some one-size-fits-all diet myths and why kombucha, actually, as great as it may be, just may not be for everyone. Dr. Ruscio is a true pro and a true pioneer in this space. He's incredible. He is a DC naturopathic practitioner and researcher who is passionate about helping people heal their gut and thyroid issues, especially those who feel like they've hit a dead end with traditional medicine. As the founder of the Ruscio Institute of Functional Health, he takes a research-based approach to tackling complex GI conditions, offering fresh solutions to patients who've tried literally pretty much everything else. He's the author of Healthy Gut, Healthy You, and has developed a game-changing elemental diet formula, and also hosts the Dr. Ruscio radio podcast. Head on over to drruscio.com for a wealth of free information about how to heal your gut and thyroid dysfunction. He also has amazing products that colleagues of mine absolutely swear by. Hey, folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Welcome to the show, Dr. Michael Ruscio. It is such a pleasure to have you here today.
It's great to be here.
Yeah, well, it's been it took us a while and mostly my fault. So I apologize.
Oh, good. It happens. Busy schedules, right?
Exactly. So I don't think anybody can be in this space without having without paying attention to gut health. I mean, I don't know. I can't even imagine. Is there a stat out there that would indicate how many people are walking around with some kind of gut issue that either they know or don't know about? Do you know?
Yeah, there is. There's a grouping known as functional gastrointestinal disorders, or FGDs. It's broader than IBS. People have probably heard about IBS. That's bloating, diarrhea, constipation. That's maybe 15%, but there's other people beyond that don't fit that criteria. Just constipation, or just bloating, or just reflux, or just this feeling of I eat certain things, my joints get inflamed, my skin gets funky, right? So this is what functional gastrointestinal disorders encapsulates more of. Not all of it, but more of it. And that's about 40% of the population. So we could maybe say 1 in 2 or close to 1 in 2 people have the population have some sort of digestive thing that they're grappling with.
Yeah. Well, what about when you look at, the connection between gut health and mental health? And if we look at the number of people dealing with mental health issues right now, I would, from everything that I've seen and read and consumed, even if the gut health is not the originator, there seems to always be a component and certainly an interplay between the two that very often just isn't being addressed.
Absolutely. The IBS diagnosis of late has been reclassified as disordered gut-brain interaction.
Oh, interesting.
That's how pivotal even the most conventional researchers are starting to see it's not just gut, it's gut-brain. And kind of to your point, it's bidirectional. For some people, it seems to be more so the brain impacting the gut, and other people, it's more so the gut impacting the brain. But that's what's wonderful about, I think, the work that we do is we're going to look at someone holistically and try to look, let's say, at their history. Is there a lot of stress? Was there some sort of traumatic event? Do you notice that you're okay until there's additional life stress and then your digestion falls apart? Okay, so maybe we start with more of a brain to gut approach in those cases. And then in other cases, it might be very triggered by foods. I eat X, Y, and Z, I get bloated and I have brain fog. So then we're thinking more so let's start with the gut and how that impacts the brain. But you're totally dead on. There's a lot of connectivity between the first brain and kind of the second brain, if you will.
Yeah, I love that. I actually listened to one of your shorter episodes you were talking about SIBO. You were talking about what caught my eye was the one diet that will fix your gut issues. It was something like the one diet that will fix your gut issues in 2 to 4 weeks. And,
right.
As a nutritionist, I'm like, what do you mean there's one diet? What are you talking about? And, listening, there is no one diet because we have this visceral response because so many people out there are screaming about the one and the other. But what was interesting going into the episode is, number one, it wasn't one, it was actually 3. There were 3 different versions of the one. But one of the things you talk about in there is how there was some paper or research that had showed that the diet was affecting the expression of serotonin receptors in the gut.
Yeah. So that's Low FODMAP. And maybe to introduce a framework with which I think about these 3 different gut types, if you will.
Yeah, I was just thinking, I just kind of dove right in there. So we can.
No, this is perfect. This is wonderful. Because I think what people want is they want a way of looking at all the diets on offer and saying, well, which one's going to work best for me? Because any clinician who talks to people on a daily basis will see, like you said, no one diet helps all things. So then it's more about, well, how do we connect the right diet to the appropriate individual? So there's 3 different gut types that at least we're using as a framework. One is bacterial overgrowth. This is SIBO, small intestinal bacterial overgrowth. IBS, or the new diagnosis, disordered gut-brain interaction. And there's just too much bacteria. And these aren't bad bacteria. They're part of the commensals.
Yeah.
But like anything, if there's too much, it can be a problem. So there's the bacterial overgrowth type. There's the fungal overgrowth type, and this is Candida. And we were talking earlier about how maybe 5-10 years ago, Candida was the thing.
Yeah,
and then SIBO got a lot more attention, and now SIBO is the thing. But we can't just discount the importance of Candida, right? So there's bacterial overgrowth, there's fungal overgrowth, and there's also what we call the immune type. This is histamine intolerance.
Mm-hmm.
And this is where people may notice, boy, I heard all about how healthy fermented foods are, so I started eating more of them, and I felt worse. Right? The kombuchas, the sauerkrauts, the kimchis, they tend to flare me. So when we look at it this way, we can select then a low FODMAP diet for the bacterial overgrowth, a Candida diet, sort of a low carb definitionally diet for the fungal overgrowth, and then a low histamine diet for the immune types. And we can unpack, if you want, what that looks like in terms of the user experience, because I think that's a helpful inventory for people to take, and then say, well, now I'm understanding why I have this food reactivity and how I can act with a diet plan accordingly.
Yeah, no, I would love to unpack those diets. But before we do that, I would love to help people to kind of, can we give them some tools or some markers to look for? And I mean, you already did on the histamine one. It's they can't tolerate, and even leftovers are a problem, right? Like I've
yes, leftovers from fermented foods, precisely. Yeah. And then what I've called the lazy man's paleo diet, which used to be me, which is lots of jerkies, lots of canned tuna or canned salmon, avocado, spinach, all these things that are quick and easy and also healthy, but simultaneously rich in histamine. And just to give a quick user perspective on that, how I discovered this in myself was, everything's good in my life, and then I have a breakfast of like a kombucha, spinach, and some jerky, and 20 minutes later I feel foggy and irritable. Yeah. And it's because at pretty much every meal, it's not to say those foods are a problem in and of themselves, but every meal I was having multiple high histamine foods. And for some people, that can exceed the ability of the body to metabolize histamine. And taking a step back, I know you know this, but for your audience, histamine is a signaling molecule of the immune system. So when people have, let's say, seasonal allergies, their histamine goes up as a part of that immune reaction. They feel foggy. They may have a runny nose. They may notice that they're bloated. There's another source of histamine beyond reacting to pollens or grasses, what have you, dietarily, right? And so if you have too much dietary intake of histamine, that's when the immune system can start being excessively triggered.
Yeah. And I love how you're talking about an excess, because also I think what I really enjoyed in that episode were, you don't seem like you're not 100%er necessarily, right? You're talking about histamine load here. And I would imagine that depending on the severity of what a person's dealing with, some people might be able to handle a little bit of these histamine foods some of the time. But the problem is that when we get told, as a nutritionist, there was a time where I told people, every meal you need to have sauerkraut on the table, and you need to have that fermented food with every meal. And these poor people, like you can imagine, like you were saying that and people get into these patterns of eating because it simplifies. They like it, for any number of reasons.
Yeah, it's efficient.
And it's efficient, all the things. You throw out less food because you're only eating 4 things. So, which is a bit extreme. But, it's that people fall into one of 2 categories for me usually. They're either eating to live or they're living to eat. And the eat to live people are infinitely easier to coach than the people who live to eat. Infinitely.
Yeah. Yeah. And this is part of the reason why I'm so attentive to not being absolutist, as you said. And thank you, by the way. I appreciate that comes through because, again, in a clinical setting, I learned so much from the people that I work with. And the people who are very staunch rule followers have a hard time not thinking all or none. And I have to repeatedly sort of coach them through, hey, we're going low histamine. This doesn't mean that if you're having dinner with your husband tomorrow night, you can't have some guacamole because avocado is high histamine. You can have some. And just knowing that it's not about getting to zero, but just reducing the load makes the application of the diet so much easier, so much less stressful. And we do have some studies looking comparatively at 100% versus 80% versus 50% compliance. And there's not a big difference if you're between, let's say, 100 and 80% in terms of how people feel. So there, there's no need to encumber oneself with all the stress of trying to go to absolute zero on histamine, on FODMAP, on carbs, whatever it is.
Yeah, no. And I'm also guessing that it varies by individual. I mean, what I've seen is sometimes you get a person who's so over the line, they do have to go they have to be pretty rigid, but it's not a forever thing. Hopefully.
Totally. Well, the analogy I use for that is if someone had a musculoskeletal injury, like a back injury, they would intuitively understand without any explanation that, you can't cycle, weight lift, run aggressively for a little while. And then you can go, you got to be careful in the acute rehab phase. And then you improve your health of the musculoskeletal tissues, and you can tolerate the activities that you enjoy. Same thing with diet. As your gut heals, and like you're saying, the rehab diet might be a little more strict for the first few weeks, the first month or two, but then tolerance almost all of the time improves. And I think we're on the same page. It's so important to set that expectation, because what can happen is people have some result from low FODMAP, low histamine, whatever it is, and they think, oh, forever, I got to be on this because I feel good, day 15 of the diet. And that can lead to really, like you're saying, also the 4-food diet plan, which is really stressful.
Yeah.
And not needed. Yeah.
Well, and will ultimately lead to other issues down the road. I mean,
totally.
We're not built for 4 foods. So, okay. So we talked histamine. I kind of took you off track, and now I'm trying to find my way back here. So we were talking about, when you were talking about the FODMAP diet and the three different versions of it. But we were talking before that about Candida having been, the main player 5-10 years ago. That's all anybody talked about. Now people are talking about SIBO. The IBS now IBS IBD has been redefined, as it were. And then people also are dealing with mold, they're dealing with Lyme, they're dealing with MCAS. So I guess the question I wanted to ask you is, and I'm sure you've in your clinic developed some kind of a roadmap for people to start to understand, okay, I feel horrible. And I see people running from one thing to another. They're like, no, it's Lyme. No, wait, it's mold. Oh, wait, maybe it's both. Okay, wait, no, maybe I have SIBO. How do you help people to kind of tease all this stuff apart to start to get some clarity around what's going on for them?
Great
because
question.
That's where I'm seeing. I am seeing so much confusion and panic. Really.
Yep. Yeah. I mean, it's a great question. It's of crucial importance. And it's one of the things I love about when we're doing the intake for a new patient. We get to learn their story. And there's a lot of hints that you pull out from their history. Because what will happen in some cases is people will read a lot about a given condition and it resonates, but they're more so connecting the symptoms that they have, and they're not making a historical case, right? So that's where just someone from the outside looking in can go through everything and rank order the priorities. That's really what it comes down to. Is it could be mold, it could be Lyme, it could be a GI issue, it could be a thyroid issue. But what evidence do we have from your history, from your diagnoses, from your family history, from the diets you've trialed, from the therapies that you've trialed, and all those sort of inform what I think of as a ledger where, let's say Lyme is one example. We have points supporting and points refuting. And we build this out for each one of these for every individual. And then you have a probability weighting, if you will, of, well, I know with the muscle twitching and the muscle pain and some of the paresthesias and the fatigue and the brain fog, you're thinking it's Lyme. And it could be, right? But I would give that sort of a moderate probability. What I see more of, just hypothetically here, is given the fact that your symptoms got worse after an antibiotic, and you have carb cravings, and you've had recurring, let's say, vaginal yeast, and you have brain fog and fatigue, it could be both, but there's more evidence. And also in the order of importance, it's more pivotal for us to address the GI issue of fungal overgrowth first reevaluate, and then consider going to Lyme. Because you're absolutely right. There can be more than one thing going on at once, but it's trying to tease out which one of these takes precedence over the other. And usually we start with the GI. It's not to say it's a hard, fast rule, but so much tolerance comes from the GI. So someone may say, I tried the Lyme treatment, but I had negative reactions. Well, part of that comes back to your gut health. So I do think when unsure, we always want to start with the gut and then reevaluate with one really important caveat, which is within a few months, we should be seeing clear indications of improvement. And what happens in some cases, as I'm sure you've seen, is the healthcare provider is so fixated on the one diagnosis that someone's a year into treating that, not getting any better, and the practitioner still wants to double down. I say we have 2 or 3 at-bats, if you will, like 2 or 3 therapeutic trials within the thing that we think it is, let's say fungus. If we don't see some clear signs of improvement after those 2 or 3 trials, it's a wrong diagnosis. Let's move on to the next thing.
Yeah, I love that. There's so much about what you just said that I was like, yes. Starting with the order of importance, again, like people are, and especially people with these types of issues that are complex, they get to a point where they don't even know what to do anymore. And they're reading about, whether it's a peptide or a supplement or a diet or whatever it is. And they want to throw it all, because all they want is to feel better. Right. And so they want to throw everything in at the same time. And I do find myself in my communities often pulling people back from the ledge and saying, you know what, you need to get to see someone. Like, you need someone who's going to help you understand what is the order of operations here. Because if you go at the wrong thing in the wrong order, number one, you could be wasting your time and your money, and you won't feel better.
Right.
And it may not be like, do you ever find that you start with that order of operations and things just kind of seem, not everything, but certain things seem to resolve and disappear that you thought that the patient thought was a horrible problem. Yep.
Yeah. You're taking the thoughts right out of my head, in the sense that early on, people don't feel well, and that stinks. Right? I've been there. I totally get it. And you'll do anything to feel better. Mm-hmm. It doesn't mean that being super aggressive with how you treat is the fastest way to cross the finish line. And that fable of the tortoise and the hare really does have a ton of relevancy here. Yeah. Part of the reason for that is if you do too much, and I had many years where I tried the very aggressive approach, and then people invariably have a negative reaction, and you have no idea of all the things we just went through, what drove the negative reaction, and you diminish the signal of, we're going to try, let's say, building on the example of Candida, some Candida treatments. We're looking for that to elicit a positive response. But if we're treating 6 things at once, we don't really know what was driving that positive response. So it's not to say it takes a long time, but we want to be a little methodical, almost like project managing someone's healthcare.
Yeah, 100%. That makes so much sense. And so does diet come in right away? Obviously it must, right? Based on whatever it is you've identified as your first order of priority.
Yes. And some people, they're already on a diet that's amply restrictive. I'm sure you've seen the people who are just so well read and so well educated that they figured out, okay, Candida and low oxalate diets are working for me. I've tried keto, I've tried low FODMAP, and this really seems to be the best. So, okay, like if that seems to be working, now I think the rest of the answer is non-dietary. And so that's where we integrate herbals or nutrition. But in the absence of someone having had figured out what the best diet for them is, then yes, it's a huge component. And I'll give you one data point that exemplifies this. There was one study looking at fungal overgrowth. They gave nystatin, so the pharmaceutical antifungal, which I think is fine, in the one group, and the other group got nystatin plus a Candida diet. 42.5% response rate versus 85% response rate. Yeah. So when we leverage diet along with an herbal or pharmaceutical intervention, it's much more powerful in most cases than just the herbal, the killer. And I think people want to zap whatever they think the thing is, which I get. And that's part of the approach, but we can't just zap and expect everything to work. Because if you're zapping on the one hand with oregano or garlic, but you're eating a diet simultaneously that's feeding that problem, it's going to be really hard to get over that hump. So yes, diet's a huge component of what we do, with the appropriate caveats of not turning someone into a fearful food state, which is the delicate balance that we always want to strike.
Yeah, no, and that makes, and I think part of that is in the language that you use, right?
Totally.
The interesting thing I think also about social media is when people are doing research about their condition and they hit a thread. Let's say the thread is Lyme, or the thread is MCAS, or the thread is whatever it is.
Yeah.
The problem is that the algorithm now starts to feed you all that stuff.
Well said.
And you get sucked into a trap, and you, as you said earlier, people start to see themselves in what they're seeing and what they're hearing and what these other people are talking about, because the symptoms are so, they're so amorphous, right?
Yeah,
like, I mean, exactly. Like the symptoms of one overlap with, I mean, brain fog could be any number of things.
So many. Yeah.
Right. And so I think one of the cautions that is important for people to keep in mind is watch the algorithms, because they're just going to deliver what you want, or what you think you want.
It's funny. We're so in alignment, because I've made this exact point in videos and in articles that thyroid seems to get so much algorithm juice.
Oh, yeah.
So, there's a pretty big problem with people being incorrectly diagnosed as hypothyroid. There was one meta-analysis, 2018 journal Thyroid, that found 37% of people were incorrectly diagnosed, meaning they're on hormone that they didn't need. They could come off of it, maintain the same symptoms, and their blood hormone levels were normal. So it's about 1 in 3 people who've been misdiagnosed. And it comes from, I think, pressure on doctors because of how quickly in Google or whatever, YouTube, thyroid comes up as a potential diagnosis.
Yeah.
And then, I understand some of the backdrop here where people go to their conventional doctor, they don't feel heard, they don't feel like they're willing to dig. And so then they go into the alternative camp, where I think we're maybe not scrupulous enough with how quickly we put someone on thyroid hormone. And the travesty there is, what often happens is then they see a different doctor, and the doctor says, oh, you're diagnosed hypothyroid, you're on Levo or Armour or whatever it is. And people aren't checking. They're not checking that diagnosis. Mm-hmm. So these people can walk around for years and years. And that's why this meta-analysis was so pivotal. It showed us that maybe 1 in 3 have been misdiagnosed. And that has relevancy because thyroid hormone does increase metabolism of adrenal hormones. Mm-hmm. And so for some people, they actually have fatigue or brain fog or poor sleep because they're on too much thyroid hormone. And this can sometimes manifest as these really, to use a really medical term, wonky values, where their TSH and their 54 and their T3, they always look kind of off. And that's what's happening when you're just forcing this hormone into the body, and the body is sort of saying, like, what are you doing? And it's trying to shunt it in different ways. So for people out there, if you're never able to get your hormone levels normal with thyroid, it might be that you're barking up the wrong tree.
That's fascinating. And how much of it do you think has to do with where people are putting the goalposts? Because
a huge component
right?
of it. Yeah.
Because on the one hand, in conventional medicine, the goalposts are like a mile away. Like if you're anywhere in this massive range, you're fine. Right? The 4-letter word. But in the functional space now, what's starting to happen, I think, is the goalposts are getting tighter and tighter and tighter and tighter. And I think what you're maybe alluding to is that maybe the right place for the goalpost is not exactly in either of those spots. We have to give it a bit more leeway.
I think this is an area where conventional medicine is closer to the truth than is functional medicine.
Interesting.
And I, as an alternative provider, I don't care. I had a very short period early in my career where I kind of drank the Kool-Aid.
Yeah.
Right? Everyone has to be gluten-free. No one can have any sort of carbs. And then coming back to our conversation from earlier about how people teach you so much, right? The paleo diet turns out didn't work for everybody. So it sort of starts to shatter that absolute thinking that you have.
Too.
Yeah. And so you become less confident
Mm-hmm.
and a little bit more thoughtful in terms of, well, man, so many people we're seeing who have, and we published a case study in the journal Nutrients and also one in a different journal, the IMCJ, Integrated Medicine, a clinician's journal, where we chronicled some of these case studies where we tried different dosages of different hormones, different dosages, and their TSH and T4 never got normal. Then we underwent gut care, and all of a sudden TSH comes down, TPO comes down, and symptoms go away. And I think there's two things going on here that are of chief importance. One is it the right diagnosis? And like we talked about a second ago, 1 in 3 are incorrectly diagnosed.
Wow.
The other is, for the people who are correctly diagnosed, they can have malabsorption of the hormone if there's a gut issue at the same time. And that's one of the case studies where we mapped out the TSH over time, and all these different thyroid hormone perturbations never got TSH normal until we just went to simple levo and then treated their gut. And then all of a sudden, TSH came down, symptoms improved. And this is because that capsule of levo or whatever it is, it's dependent upon absorption in the small intestine.
That is, well, I mean, it makes so much sense, right? And how often are we looking at that? So you talk about Hashimoto's as well. I was interested to hear that, to see that in your, because, I think of you as the gut guy, but of course the gut's at the center of the entire system. And it makes all the sense in the world. So you were talking about Hashimoto's and diet. And do you want to maybe dive into that a little bit? Because again, from an oversimplified way, you get people running around, oh, well, if you have Hashimoto's, well, you must never eat broccoli, cauliflower, kale, like any of the goitrogen foods,
right.
which maybe there's truth to that. I'm curious to hear your for me, it's always been like, well, if they're raw, probably not. Plus they're tough on your gut, but maybe if they're cooked, they're okay. So maybe if we could talk about this gut Hashimoto's.
Sure. Yeah, there's a lot here to unpack. Some of the backstory is people, as they started to become privy to the impact of the gut on autoimmunity, started seeking us out for the gut component. And so that's where we started just looking a little more into some of these things and fact checking, because people would say, well, how do I quantify, as one example, my Hashimoto's? What's the best test? And so as one example, thyroglobulin or TG antibodies do not correlate with the health of the thyroid gland, and they're not predictive of hypothyroidism, which was actually news to me. Early in my career, I was screening for both TPO and thyroglobulin.
Yeah.
But, you spend numerous hours fact checking, and there was one really pivotal study that tracked people over time, and it compared TPO or TG versus thyroid ultrasound. Ultrasound is going to give you the most proximal indication because that's what the tissue actually looks like. Yeah. It should be very high in echo. It's known as hypo or low levels of echo, because ultrasound is just sending sound waves.
Oh, so it's going to absorb. It's going to absorb it, kind of thing.
So when there's scar tissue, it's going to be much more dense, and there's not going to be any echo. Right. Okay. But when it's a healthy gland, you have all these thyroid follicles that store the hormone, and those are essentially like little liquid. They're like grapes, right? But when they're scarred, now it's very dense, and so the echo that comes back to the ultrasound is low. So they found a direct and tight correlation between TPO and what the ultrasound showed, and there was no correlation between thyroglobulin and the ultrasound. And we have a video out there if people want to look this up, and we just show the ultrasound slides. That's one of a multitude of studies that turned us away from thyroglobulin. That's helpful because it reconciles why some people say, I'm feeling better, I went on vitamin D, I cleaned up my diet, my TPO looks healthier, but my thyroglobulin is still abnormal. And unfortunately,
so people are making themselves nuts with this stuff.
Yeah, some people are told, well, you got to go harder gluten free, and so that's one thing. At least according to the best evidence that we have, we can put to rest. Just look at TPO. If you want to go an extra step, you can look at ultrasound. So TPO is predictive, but the other part of this I really want people to know is that about 20% of the population has elevations of TPO. But only about 5%, and let's not say only, but 5% become hypothyroid.
Of
So
the
what that
20?
tells us, yes.
Of the 20.
No, just comparatively. So
Yeah. Oh, I see.
what that tells us is 75% of people with elevated TPO maintain normal thyroid function. 25% become hypothyroid, which I think is empowering because oftentimes people are told if you have Hashimoto's, it's almost for certain hypothyroid, almost like they're the same thing. And they're not. They're two very different things. The TPO tells you that there's this immune damage to the gland, but it doesn't guarantee that you're going to have hypothyroidism. The other data point here that was really interesting, it was a prospective study in Tehran. They found that if the TPO antibodies were above 500, that's when people had risk of converting to hypothyroid. But if they were below 500, the risk was minimal, almost insignificant in terms of their likelihood to become hypothyroid. So it refines the target of the TPO, meaning it's not, and this is so true in many areas. We don't look at a blood sugar that's above 99 of fasting glucose and say, if you're anything above 99, you're diabetic, right? If you're 103, you're diabetic. We look at a gradation of how high it is, and that assigns risk. So yeah, if you're 163, we need to act. If you're 103, not really a big deal. It could be the dawn effect if someone's on a low carb diet. It could have been, you had too much caffeine or too much stress. So that's really important to bear in mind. And then there are many things we can do to lower that TPO even further. As I'm sure your audience knows, vitamin D, selenium, myo-inositol. But of late, there was a couple of studies looking at red light. Now,
Love this.
This is red light done on the thyroid gland. This was surprising to me because if you look at, let's say, vitamin D and selenium, on average, they lower TPO by about 200 points, which is great.
A lot.
But these studies found a 600-point reduction with the red light.
Wow.
So it's a very, I think, interesting tool that I think taken collectively between diet, nutrition, and red light, we can really make a big dent in that 25% of people and probably make that much smaller.
Yeah. Well, the red light, I heard that you talking about that because when I saw that, I was like, wait, what? So I went diving into it. And they were seeing like reduction of like, what was it? Like in some cases, 400 or 500 points. Using, was that it? Am I right?
4 or 5, and even up to 600-point reduction, which was, pretty remarkable. Right. And also that corresponded with a lowering of TSH. So improved output of thyroid hormone.
So are we thinking that the red light basically by activating the mitochondria and the thyroid is essentially giving it the energy that it needs to do what it needs to do? Like and I'm oversimplifying basically, but what I find fascinating about that is what if we can, restore energy to this gland and then it just kind of does what it needs to do. It takes care of the rest kind of thing.
Precisely. Yeah. The theory that I think makes the most sense here, I can't say this has been proven because there's not a lot of research here just yet, so it's a little more speculative, but there's this theory of the gland-blood barrier. Yeah. And so the barrier, if it's healthy, you don't have leakage of thyroid particles into the bloodstream that then activates the immune system. So to your point, if the gland has ample energy to do all of the repair it's trying to do, then there'd likely be less leakage and then less triggering of the immune system. And it does come back to the mitochondria. The mitochondria are these little assembly factories where there's 4 complexes, and the red light helps stimulate the cytochrome C enzyme, which sits between complex 3 and 4 of this energy production pathway. How that manifests is lower TPO, lower TSH, and then other studies finding improved musculoskeletal recovery, less skin wrinkles. So it is, for a fairly inexpensive and non-invasive therapy, I think it's something that a lot of people should be considering, especially for thyroid.
Oh, 100%. I just interviewed someone who, they are manufacturers of a red light device. And it's a low level red laser, basically. He was talking that they were starting to look at the thyroid as well, but their device can be put around the neck. And he talked about this has nothing to do with anything except that there was a study in Japan, where they used, I think it was around 800 nanometer frequency red light laser and irradiated the carotid arteries. And the study was on 229 women who were infertile, and 29% of those women became pregnant. And
Wow.
and of those, 24% carried to term. Now, there's a million different reasons why someone can't conceive, right? So,
Right.
which would explain why it was 29% and not 80 or whatever.
Right.
But,
Yeah.
Speaking to this whole idea of mitochondrial, how critical mitochondria is to so many different, well, to every single thing in the body, really.
Right.
But somehow this irradiation here was able to help the ovaries, who are also very dense in mitochondria, to function better. So
That's so interesting. And was there a control group in that study? Do you know if they did like a sham laser versus the actual treatment
what?
group?
I don't know. And that's a really good question. I think that would be, I can actually reach out and see if I'll send you the study. If I can, I'll look and see if I can get my hands on it myself. Japan. Sorry, guys. We'll edit this part out.
Gotta take notes. No, I get it.
Well, sometimes you got to take notes when there's a to-do, because then, the listeners are like, hey, Nat, did you ever get that answer? I'm like, what answer are you talking about? Okay. Well, that was like a little fascinating trip down a whole other place, because, this interesting thing about, what are your thoughts on gluten? Before I ask that question, tell me, because the world is divided into two camps. Gluten is the food of the devil, and gluten's just not that big. I don't know that too many people are saying it's not that big a deal, but there's definitely a prevailing narrative in the alternative space that is gluten.
Right.
Forget it.
Right. I think what happens in a lot of these situations is that there's an overcorrection. There's little awareness on something, awareness pops up. And oftentimes, a lot of this, I think, is a byproduct of the algorithms and how we select for extreme messaging. Because if you think about it, the scientist who's more of, there's some data for and there's some data against, it's not as compelling as saying gluten upregulates inflammation for 6 months in people with Hashimoto. It's not true, by the way. I don't think that's true. But that messaging is so much more compelling, and it kind of just catches wind really easily in the blogosphere, the podcastosphere, whatever. A few things I'd say on gluten. It is certainly an issue for some people, but the stats, right? This is where fact checking and getting an idea of risk quantification is so crucially important. Because if we just say gluten's a problem for some people, especially if someone who's not feeling well hears that, they're thinking 70% of people, 80% of people, 90%, right? They don't know.
What people? Yeah.
Yeah. Or how often. Yeah. So if you look at the data on gluten regarding non-celiac gluten sensitivity, the estimates range anywhere from a little under 1% of the population to a little over 10%. So I think we can average and say 5, maybe if we're being super generous, 10% of people have an issue with gluten. So it is something, but I think it's, again, really important to contextualize to that degree of the population. The other thing that I wish got more press is that not all gluten reactivity is the protein antigenicity of gliadin or gluten itself, but it's actually the FODMAPs. So wheat, rye, and barley are FODMAP rich, right? And when people cut gluten out, it's likely more common that they are reducing FODMAPs, but it's the reduction of FODMAPs that's leading to a healthier gut, and then maybe less gut brain, maybe better absorption, therefore better skin, better hair, all these things. So, okay, no matter how we get there, if the dietary change improves your health, I'm with you. Yeah. But the pernicious thing is that well over 50% of FODMAP intolerance is recoverable with time.
Yeah.
Because when you reduce FODMAP intake, FODMAP being a prebiotic essentially that feeds bacteria, you correct bacterial overgrowth. Mm-hmm. And then you can actually tolerate FODMAPs in the future. So if the gluten intolerance is FODMAP mediated, it's recoverable. Yeah. And that's the thing that I think is left out of this conversation, where everyone's assuming if I went gluten-free and I felt better, it's lifelong protein inflammatory allergy.
Yeah. Well, it's a really good point. I think the other thing about gluten that is tricky is that it's the foods that are high in gluten. The gluten foods are really good. and they
Yeah.
taste yummy and people love them. And,
Yep.
you know, when bread is in your life and with reckless abandon, you have toast for breakfast, you have a sandwich for lunch, you have bread with your dinner, maybe you have some pasta. Like I think there's an addictive overconsumption piece to gluten containing foods just because of the nature of those foods. And
Sure.
they can hit the
Yeah. I
mark.
mean, it's one of many a baby with the bathwater arguments,
Yeah.
right?
Yeah.
If a lot of gluten foods are highly processed and hyperpalatable, then it's easy to sort of have this guilt by association. And people say, I went gluten free, but they really also cleaned up their diet quality. They went lower carb, they reduced processed food consumption.
Yeah.
So, the one thing I'd want people to take away is, unless every time you reintroduce gluten, you have a very stark reaction to it,
Mm-hmm.
it's more likely that it's a FODMAP issue for you. And if nothing else, I'd want people to have the freedom, coming back to you're at dinner with your husband, to have a slice of bread. Am I arguing that bread at a restaurant's a health food? No. But do I want you to be able to have a glass of wine or two and maybe some bread? Yeah, I'd like people to have some food freedom and not feel like they're always living their life in this really narrow box.
Yeah, 100%. What about the idea, once we're on the topic of gluten, what about the idea that people go to Europe and feel that they feel better on the gluten foods that they eat there? Because I was in Paris and you better believe I had baguette and croissant. Like,
Sure. Yeah.
was
Good.
not negotiating that. But so many people will talk about that they feel that they can eat gluten containing foods in Europe. And yet the gluten containing foods in North America really make them feel unwell. Do you think there's something there, or?
I do. I think there's a few things. One, it's probably that many European nations or food manufacturers are using less gluten, less processing. You probably saw this whole big congressional meeting where they talked about, hey, like, the European Union doesn't allow XYZ colorings and additives,
Yeah.
but we do, right?
Yeah.
So I do think that's one component of it. The other two would be, maybe people haven't really reintroduced here, and they finally did in Europe, and they discovered it may have been more of a FODMAP issue. And then the third is, if you're under less stress and you're on vacation, this is more so the brain gut people.
Yeah.
Because they may remark, boy, like, I had wine, I had cheese, and they, they think they can't do alcohol, they can't do, and I'm not trying to disparage anybody, but the principle I'm trying to poke at is sometimes we avoid just based upon faith and fear.
Mm-hmm.
And then sometimes when we're in a relaxed environment and we actually test these boundaries, we find, I'm actually more tolerant to these foods than I thought I was. So I think it's like all of those things together.
Yeah, no, I think you bring up a good point. I mean, I often will tell people when I was working with clients, I would tell them what we're trying to do is build resilience into your system so that you can,
Yep.
20% of the time, or 10, depending on the person, 10, 20, maybe 30% of the time, go offside or eat these things that you don't normally eat. And the rest of the time you eat a different way. So last little beating down of the gluten monster, last one. And then I'll ask you a couple more questions, let you go. But what about the narrative that gluten damages the microvilli in the gut?
That's true. Well, so it's true in two use cases. It's true if there's protein antigenicity, but remember, that's a smaller subset of the population.
Yeah.
It's, to some extent, it appears to be true for the FODMAP component of gluten also. And this comes back to the earlier question you asked I didn't answer, which was how certain diets can improve serotonin cell density in the gut. And so that's the low FODMAP diet. And there's some evidence showing that a low FODMAP diet at least reduces leaky gut and reduces inflammatory cytokines in the gut. So it's likely that a dietary plan that improves gut health is going to improve microvilli health. And there's another example of this too. But again, the principle is, if the diet heals, then you have better villi and then also better enzyme production, because the villi make a number of enzymes. And that was evidenced by one trial that found a low histamine diet actually improved the level of the DAO, or the histamine metabolizing enzyme in the gut. So, coming back to that rehab analogy, it does seem that the healthier your gut gets, the more you can tolerate, or the healthier the back injury gets, the more movement you can tolerate.
Yeah. Well, and to take that analogy one step further, when your back gets healthy, you don't go back to doing the stupid thing that you did to injure your back. And when your gut gets healthy, maybe you don't go back to this preponderance of these foods that may have gotten you into trouble in the first place. I think
Totally,
I
totally.
think we may be coming to a place of, in this discussion, even of talking about, once you've corrected the imbalance that you're existing in, whether it's FODMAP intolerance or histamine or whatever the case, or fungal overgrowth, and you've had to do this crazy anti-Candida diet, which I did for over a year once. Like, it was intense.
Mm.
The idea that, and you've said this a couple of times, you don't stay there indefinitely. You now look to come back to a place of balance, and your balance may be different than the next guy's, but you do come back to a place of balance that gives you more latitude, if you will.
Yeah. And you also learn, what your triggers are. Like, some people, coming back to that gut typing of bacterial, fungal versus immune, some people may notice they're trucking along really well for a year or so, but then they get a bit too liberal
Yeah.
with alcohol, with stress, or maybe, they had a child. And so sleep got really dodgy for 3 months. That's when, having in the back of your mind, oh, going low carb, going Candida really helped me a year ago. Let me just sort of contract a little bit more in that direction to help things heal. Or let me pull out that rehab plan that was helpful for my back previously.
Yeah.
That's the way I would think about this: is you discover what works for you, and then you can do like a mini rehab plan if you're ever in a flare in the future.
Yeah. That's such a great way to think about it. And I think that, it's just, this all seems so much more calming. It just seems much less frantic, than the messaging I think that a lot of people get quite often.
Yep.
For the FODMAP diet, do you like? Never mind the FODMAP line. Here's the last thing I'd love us to finish on. We talk about, there's a lot of chatter about how modern life is essentially very challenging to gut health. Like, it's, we're exposed to toxins and pollutants, and if, unless your diet is pristine, which we know it's not, there's all the different things that may compromise the integrity of the gut.
Right.
And how do you feel about saying or do you ever recommend to your patients, once or twice a year, it wouldn't be a bad idea for 30 days to do X, to maybe come back to a more FODMAP centered, FODMAP diet.
Sure.
I
Yeah.
was going to say FODMAP centered, not meaning that they were going to eat lots of FODMAPs, but
Right. Lower FODMAP centered. Sure.
yeah.
Sure. The way I approach this, I don't think there's a absolutely right way to do it, but I would say, when you feel like things are starting to shift a little bit, if you're a little bit bloated or bowels are a little loose or you're a little bit backed up, that's when I would revisit.
Okay.
In the absence of anything that feels off in your system, that's when I'd rather people start focusing on nutrient density. And there's a great book by Sarah Ballantyne called The Nutrivore, and she lays out the top 100 nutrient dense foods. So I would like people to start thinking about, how do I eat my way into more nutrition, make that sort of the focus, but having in their back pocket, like you said, do I need to go back to a, loose Candida diet for a month, or a low FODMAP diet? I would maybe sprinkle in something like doing a little bit of fasting periodically. Like, maybe you have a short fast you do. Maybe it's one meal a day, and you do that for, let's say, a week, or maybe you do, every Sunday I'm going to do one meal a day for a month. Just something that kind of give you a little bit of that fasting replication that we know we got as hunter-gatherers. We aren't always in the fed state.
Yeah.
So I do think it's helpful to sort of exercise metabolic flexibility, if you will.
Yeah. Yeah. No, I think that's really great advice. I mean, the once a week, one meal a day, or 24-hour fast, if you will, like from dinner to dinner, let's say,
Yeah.
is such a powerful tool that I think we forget about so easily. And just giving the whole body a break, really, from eating, and maybe your brain a break from eating, can be a really powerful tool. Okay, I'm looking at the time. I really wanted to ask you about seed oils. Do you want to do that quickly before we say goodbye?
Yeah,
We have time for
that's
that?
it's
'Cause
funny because
another
we're
inflammatory.
yeah, and we're getting ready to record a piece on this maybe tomorrow, but soon. In either case, in any case, the long and short on seed oils is I found myself about 2 years ago recommending against seed oils, and then I caught myself and I said, well, hang on a second, how many times have I fact checked a belief, whether it's one I heard from others or one of my own beliefs, and found it not to be true? The thyroglobulin antibodies as one case in point, the gluten intolerance prevalence as another point, paleo for everyone as yet another point, right?
Mhm.
So the arguments about seed oil, I think, have been largely overblown in the sense that there's a lot of guilt by association to processed foods,
Mhm.
where it's one of the main fats used in many processed foods. But when you drill down to the arguments and you disentangle sort of the guilt by association, like the processed foods, what you see is linoleic acid, the omega-6 rich foods, they're not pro-inflammatory. And there have actually been a number of studies that have looked at this. The backdrop is when, or at least the backdrop philosophy was, you want to have the appropriate balance of linolenic and linoleic acid in the cell membrane.
Mhm.
Too much linoleic acid, too much omega-6 feeds arachidonic acid,
Right.
and that sits atop of all these inflammatory cascades like the LOX and the COX enzymes. So if anyone's taken an Advil, they've blocked COX,
Yeah.
right? The COX, the cyclooxygenase enzyme. But this is, and that's something I had said many years ago, like, be careful of arachidonic acid, be careful of omega-6 because they're pro-inflammatory. It turns out that the body tightly regulates conversion of linoleic acid, omega-6, into arachidonic acid. It's less than 1%. In fact, some
Interesting.
tracer studies have found it's about 0.2% of dietary linoleic acid or omega-6 intake, which includes seed oils, is converted into arachidonic acid. Now, that's a mechanistic argument, but there's also well, does this fuel heart disease? Does it increase inflammation? There's two studies, the Sydney Heart Study and the Minnesota study, that did find correlations to higher levels of inflammation with higher linoleic or seed oil intake. However, there are many other studies that found neutral or beneficial effects of replacing some saturated fat. I'm not saying saturated fat is bad, but
Yeah.
replacing a small amount with omega-6 actually was neutral to beneficial. And I think the problem is the thought leaders who are anti-seed oil cite the Sydney or the Minnesota study, and they leave out the 6 other randomized control trials that found neutrality to benefit. Why this really matters is because those 2 studies, especially I think it was the Sydney study, they didn't control for trans fat intake. So part of that association could have been due to trans fat, because I think if I'm remembering correctly, it was a margarine, or not a margarine, it was a hydrogenated seed oil that was used. So they were actually giving people omega-6s that were trans fat.
Yeah.
So if you don't disclose that, then you're not actually saying that an otherwise healthy source of minimally processed seed oil causes heart disease. What you're actually saying is that hydrogenated trans fat seed oil causes heart disease. So, there's the arachidonic acid. Mechanistically, that argument has been disproven. If you look at the meta-analyses that summarize all the good clinical trials, and there was one by Hamley and one by Cochrane, they found neutrality to benefit regarding heart disease, inflammation, and a reasonable intake of omega-6 and seed oils. If you look at the hexane argument, so that the argument here is, well, it's processed and these chemical solvents are used, and it's like a byproduct of cottonseed oil or cotton production. Well, we can say the same thing about whey protein. Whey protein used to be discarded, and now it's used as a great way to maintain muscle mass and get inadequate protein. So we can't just say because it's a byproduct of some other manufacturing that it's automatically bad. You can get totally around the hexane piece by using cold processed or expeller pressed oil.
Okay.
As compared to chemically extracted. But even in, I think it was an Iranian study that looked at the chemically extracted versus the cold press, there was no difference in inflammatory markers between the two. So the amount of hexane that's actually in the chemically extracted oils seems to be so low as to not cause an issue. And taking a step back, I don't care. Like I'm not a seed oil advocate. In fact, if anything, I lean more paleo, more ancestral. But if we're just going to take a preconceived paradigm and then cherry pick to support that, we're not using scientific research to learn. We're just using it to sort of misleadingly footnote our prior beliefs. So what I would say is, when looking at all these data points, it's really hard to make a case that seed oils are highly deleterious when we factor out some of these things like trans fat consumption or association to processed foods. And then the other one that I would just say really quickly is the heating and the reheating. Mm-hmm. That is an issue for many oils.
Yeah.
In fact, we can't just say seed oils are the only oils that, due to having less double bonds and having more double bonds and being less saturated, are more easily oxidized, because that happens with other oils too. So the bottom line there is deep fried foods and restaurants that are reusing oils, even if it's avocado oil, you're going to run into the same problem. Yeah. So I appreciate one of the points from the anti-seed oil community, which is get the crap out of our processed food and reduce processed food. But I don't think we can say if someone wants to have a small amount of safflower oil or whatever it is, that's going to have a deleterious impact on someone's health. In fact, if we want to get a little bit mechanistic, and sorry if I'm going far afield here, but the mitochondrial membrane is actually quite rich in omega-6. Yeah. And some are even recommending, to help spur mitochondrial function, ensuring you get inadequate omega-6 intake. And then the final point, is the balance of omega-3 to omega-6 doesn't seem to be the key issue. It's just making sure you have adequate omega-3. Yeah. Meaning, and some studies have directly measured this, if you reduce or you increase linoleic or omega-6 intake, it doesn't impact inflammation. But if you have a deficiency of omega-3, it does. Yeah. And this is also something that I think the seed oil camp sometimes is, they're too pro meat, and I love meat. Like, don't get me wrong. I would very easily eat steak every day, right? Like no problem at all. But if you look at Ballantyne's work about nutrient density, there's a high representation of fish in that most nutrient dense food list. And if you look at some of Lauren Cordain's work surveying hunter-gatherers across the globe, yeah, the more you go away from the equator, and therefore you have a higher consumption of meat or animal foods, fish is the main food that increases as that population shift or that latitudinal shift occurs. So if anything, I would say, don't sweat the omega-6 so much. Make sure you're getting an adequate omega-3.
Yeah, I love everything you just said. It just brings such context to the conversation. I think, people fail to understand that we cannot function, we cannot survive without omega-6 in our bodies. Like it, as you just said, like it's a major component of every healthy cell membrane. And maybe what we need to think about is the quality and where we're getting it from, like all the points that you just said. I just thank you for that. I think that's a really great place to end. Although, you're the kind of guy I have 10,000 other questions for. So,
oh, thank you.
But I think what we're going to do, because I didn't even get to ask you, and I want to respect your time, and we can edit this piece out if you want.
We can go for another 10 minutes if you want. If there's a piece you want to hit.
The last piece was, you mentioned before we started recording that you do sometimes use peptides in your practice. Yep. And we had an interesting conversation about that. So maybe we could just finish off with, where do you feel peptides fit in when you work with patients?
Sure. I think peptides have the most applicability, not actually for gut health, because there's just so many amazing tools that we have that are well studied, that are safe, and have multiple benefits. Where it's hard for me to make a case that BPC 157 would supplant an elemental diet reset, probiotics, antimicrobial herbs, and sort of what we were talking about before is if there's a imbalance in the microbiota, fungal overgrowth, bacterial overgrowth, that's an ongoing source of damage and inflammation. So maybe someone improves from BPC, and that's all fine and good. Any win, like I'm within reason, right? Any win that's not ridiculously expensive and doesn't sacrifice your quality of life to too far of a degree, I'm on board with. But you might be really treating the effect and not treating the cause.
Yeah.
So from an order of operations, I look at peptides as sort of when we pivot, and this is actually a conversation I was having in my last visit just yesterday, when we pivot from getting you devoid of major symptoms, and now we're going to more optimization, this is where I think peptides are wonderful. So maybe some BPC, maybe if we're trying to improve performance, thymosin beta-4 or CJC with ipamorelin or tesamorelin. I think there's a lot of cool experiments we can do there, or maybe some cognitive peptides. But there's such a powerful core of gut therapeutics, your gut type, reducing inflammation, figuring out if it's bacterial, fungal, or immune. That is going to get you so far that I would absolutely say start there. And then the peptides are kind of the cherry on top.
Yeah, I adore that answer, because BPC, for all the many different pathways that it affects, is never going to change your microbiome. It's never going to kill off bacteria. So that's I think that's a good place to end, because we've covered a lot of ground. So
yeah.
Thank you so much for joining me on this little journey through the gut. I think you're the perfect guy to take us through I really love your approach. So thank you so much for being here. And maybe can we share with the audience where they can find you, and if they want to work with you and your team, how they do that, because
Sure.
I do love the work you do.
Yeah.
Thank you.
And thank you. It's been a ton of fun. Really enjoyed the conversation. I'm at drruscio.com, druscio.com. We have a telehealth clinic. I wrote a book a few years ago. We have a number of supplements that we've developed. We have a YouTube, a podcast. So there's a lot of information out there. And I just love helping people navigate this, because as someone who's been in the throes of not feeling well, I appreciate how confusing it can be, how you can blow a ton of money on testing and also get really anxious about the extreme nature with which a lot of these things are discussed. And the other thing I'd want to say to people is just take a breath, and if you can be premeditated and analytical and stepwise, it's amazing how the body can heal. So, one step at a time in a measured approach. And again, the body wants to be healthy and robust. There's oftentimes one or two monkey wrenches in there. And as soon as we excise those, there's no need to be afraid of food. There's no need to use a ton of supplements. Sure, like a couple of things with the diet to be cognizant of, and maybe some supplements and peptides, but the body's amazing in its ability to heal.
Thank you. That was awesome. Thank you again. It's been a pleasure, and I look forward to maybe doing a part 2 someday with you. Thank you.
Yeah, same here. Thank you.